Okay, I started.
To start with the skin assessment and the PVS assessment, we'll first make sure we have the right patient. So that's just checking the armband. We'll also lower him to so I'll ask that it's okay that we take the measurements and assessments. So we'll be starting at the head and neck. We'll want to check for skin assessment, so we'll be noting any color discoloration like jaundice, pallor, cyanosis, so any blueness or yellowness of the skin, any lesions, rashes, any signs of edema or dehydration. So for the PVS assessment,
Why am I so worried?
we can start by looking for any, again with the skin assessment, signs of color to show circulation.
So we're assuming that
We'll be palpating the cervical.
I do have a phone.
As well as the temporal arteries. So when we check the pulses throughout the assessment, we'll be noting for equality as well as force. So 0 being no pulse, 1 being weak or thready, 2 being normal, and 3 being bounding. And as well that they're equal on both sides of the field. And then for checking the carotid, we're going to check bilaterally but not simultaneously.
A little bit higher. But it looks pretty good.
Yeah, unilaterally. Okay, perfect. And again, noting in our documents any skin abnormalities or tenderness. Okay, that's good. And yeah, we're rating the 0 to 30. So for the next portion, we'll do the arm and hand. So to start with, we'll just be doing the skin assessment, so palpating and inspecting. We can do the temperature with the back of the hand for any warmth or coldness. Again, noting the color, if it's pink or too white or blue. For checking circulations, we'll do a capillary refill. So holding onto the nail, and when it releases, noting how fast it refills to that proper color. So we'll note if it's brisk or sluggish. If it's brisk, it'll take 2 seconds or less to refill.
Okay, let's go. Okay, so the first thing I'm going to do is introduce myself.
So now we'll start with the PVS assessment to look at the pulses. We'll be starting with the radial pulse. So just noting that, and we can do that bilaterally, and noting that if they're equal and what the force of them are. We're reaching up to the brachial artery, again noting the force, and if they're equal.
And I'm going to check for any rashes.
So now we'll be doing the chest and abdomen. So again, maintaining patient dignity, the hands and
yeah. And then I'm going to check his temporal pulse. And it would be about here, and then I'm going to note.
So again, palpating, noting for any tenderness, as well as checking color or any lesions or abnormality for the skin assessment.
Not simultaneously, I do not want him to faint. And also while I'm up here, I'll check his lymph nodes as well, about here. I think that's
and report any findings on your worksheet. So for checking the back and the buttocks, again, we want to maintain dignity when training the patient, so I'll get you to help me there with that.
I'll check the temperature while I'm here, just to make sure that everything's good.
So just raise
I'll check his brachial pulse about here. I'll check his radial pulse about here. And his ulnar pulse.
Making sure the railing is up so that when he turns, he doesn't fall.
And when I check his pulses, when I check his brachial pulse, I'll also check on this side to make sure that they're equal strength. And I'll do that also for the radial pulse and the ulnar pulse. And while I'm here, I'll check his capillary refill. So ideally, you want it to be 2 to 3 seconds. So I'll just push on his sternum and then let go and watch how fast it refills.
So we'll start by making sure that we have a mat underneath.
I'll check his abdomen.
His hand is out as
Look for edema, any swelling, tenderness, redness, discoloration, anything like
So
that.
we'll be raising the leg here. Make sure. So again, making sure we're maintaining dignity.
And I'll check his femoral pulse here, and his
Again, that we're not pushing out any joints. So again, we'll just be inspecting and palpating the back for any color or rashes or lesions.
and then his
We can lower them back down.
PVS pulse, which is kind of between his two toes, about there,
On both sides. Okay.
and then his
So for the leg and feet, again, we'll start by inspecting and palpating. We'll note any discoloration or temperature differences, so we can bilaterally check to see if the temperature changes at any point, how the color is. We can do a capillary refill of the toes as well, again noting if they're brisk or sluggish. For the PVS portion of the assessment, we can start by palpating for the femoral artery to find the femoral pulse. So again, just palpating there. And then moving down, we'll go for the palatal. So lifting the knee up, checking in here for the pulse. And again, with both these pulses, noting the force of them and the equality. Moving down to the foot portion, we will assess the posterior tibial. So just in there, again, noting force and equality on that 0 to 3 scale, as well as the dorsalis pedis. Pedis dorsalis?
Yeah, no,
Dorsalis pedis on the top of the foot there. So again, noting force and equality. Perfect. So we can put the patient back up. 30 to 45 degrees. Thanking them and letting them know we're done with the and lowering the bird.
That was good. You got it all.